Hello, my name is Muzaffar, and in this video, I will be revising the rheumatic fever, clinical manifestation of rheumatic fever. So before um, going further, I shall be giving you introduction back to what is actually rheumatic fever. It is defined as inflammatory disease involving joints, skin, nervous system after post-sequel infection of streptococcal group A streptococcal pharyngitis, group A beta hemolytic streptococci. So after the infection, we will see when the rheumatic fever is manifested, we will see clinical manifestations of rheumatic fever, which are very well explained by Jones classification, Jones criteria. Actually, it's a revised criteria of 1992 that was published in 2015. So in Jones classification or criteria, we have a criteria including two major or two minor with one major. It should be like this: two major or one major plus two minor with an evidence of recent group strep infection. So now, what are the major and minor criteria in Jones criteria classification? So first one is polyarthritis, which is a very early manifestation of rheumatic fever, almost in 75% of population. So the joint involvement, which we call as a polyarthritis, it's a migratory polyarthritis. Second one is carditis. It's also an early manifestation. Then we have erythema marginatum. It is also an early manifestation. Then we have two late manifestation, which includes like subcutaneous nodules and siddhanum chorea, which is like and purposeless involuntary muscular actions, which is manifested is in change in speech, handwriting, and other nervous system manifestations. Now, what are the minor criteria? Minor criteria include like arthalgia, prolonged PR interval. That's very important. Prolonged PR interval ECG change in rheumatic fever. And then we have fever and elevated ESR or CRP. Erythrocyte sedimentation rate is elevated, or C-reactive proteins are elevated. This is again a minor criteria for this. Now, after when we will be taking the history of a patient, we see the clinical picture is very obvious from Jones criteria. Then we have to repeat some diagnostic features and the diagnostic techniques, which includes like echocardiography, and we can go for we can go for laboratory analysis, bacterial culture. After that concrete diagnosis, the treatment of choice for rheumatic fever is actually antibiotic therapy. So this was all about Jones criteria. Thank you very much. Stay blessed. Goodbye.